this is what our units of blood look like, and we will either be giving, if it's emergent, O negative or O positive blood. O positive blood can be given to anybody that's not childbearing age. So when you're spiking your units, first when you look at the blood, you'll want to verify. We'll give you a sheet, and you'll have lot numbers, which are here. You'll have expiration date. You'll have a band number on the patient, so the band number will coincide with the sheet, and that's their ID blood band. And the blood will either be, like I said, O negative or O positive, unless we've had time to cross-match, then we'll send them with their specific. So when you spike a bag, you'll use a different tubing for every unit of blood, and that's because if they have a reaction, you won't want to throw that unit away. You'll just keep it in a bio bag and bring it back to the hospital.
Clamp one side. Up above the filter. And then you clamp your saline side, open your blood side.
And you can use either of these. It doesn't matter which one you use, but to open these, you just pull these open like this and yank it, and then you'll prime the blood down. They peel apart like that. So then you prime it with the, and have the blood in the tubing, attach it to the patient. There's times it'll be on a pump, there's times it won't. And then when it's done, when the unit is done, you clamp off to the blood, and then you open, and you don't have to put all of this in, especially with trauma patients or whatever patients we're trying to minimize fluid resuscitation with. It's just enough to clear that line. Then you could save this and use this for a second unit. You would just have to unspike it and get new tubing. Or if you're taking blood from us, just ask for some of these 250 bags. If you need more tubing, ask us for tubing, especially if it's on a pump. And you just watch for reactions, which are spiking of fever, increased respiratory rate, abnormal heart rate, like a heart rate increase. The patient might get flushed or feel bad. Typically, if you're going to be transporting our blood, they've probably already had some of ours here. If you do get a reaction, you just shut that blood off. Don't run the fluids through, don't get the rest of the blood in the line, just detach the blood, and then you can give them a little saline bolus and then give the doctor a call. So taking multiple units, we have a styrofoam cooler here we can send with you with some ice packs. And if you're getting multiple units, then the doctor would probably tell you, like, give all of these units or not, or watch for these vital signs.
And switch your tubing each unit.
Switch your tubing
each unit.
Yep.
Okay. But it should be the same type going with us,
correct? Yeah. It'll either be O positive or O negative, or if they have had time to type and screen, it'll be